We would love to hear the story of your career. How did you choose a career in healthcare, as well as your journey through several different patient experience roles? How did all that come about?
My father inspired me to pursue a career in healthcare operations. I always knew I was going into healthcare, but my goal at that time was pretty straightforward. I planned to work my way through operations and eventually become a hospital CEO. But along that way, I became fascinated by something different. I noticed that two patients could receive the exact same type of clinical care, but walk away with completely different experiences. One might feel safe and respected, another one might feel confused and unsure if they trusted the system. That gap stayed with me, and it led me into leadership roles focused on patient experience, consumer experience, employee experience at organizations for-profit, not-for-profit, faith-based, not faith-based, rural hospitals, large tertiary health systems. We like to think we're terminally unique in healthcare, but we're not. But over the time, I really realized that patient experience, it's not about hospitality. It's about how the system functions. And at that point, I was studying healthcare from the leadership side, but I had not experienced it yet from the patient side.
You've had the rare experience of being both a healthcare executive responsible for patient experience, but also as a cancer patient yourself. How did being on the receiving end of care change the way you thought about patient experience leadership?
I didn't realize the knowledge gap that had existed in myself before I became a patient. Because before cancer, I understood patient experience intellectually. After cancer, I understood it emotionally. When you become the patient, you experience something totally different. You experience those spaces between the operations, between the processes, the tone of voice when a diagnosis is delivered, the delay in a return phone call, the look on a nurse's face when they enter the room. Those moments are rarely measured, yet they shape trust. What I realize is that patients don't experience healthcare in these isolated encounters or these episodes of care. They experience it as a journey made up of hundreds of micro moments. When leaders start seeing that system through that journey lens, it changes everything about how we should design care.
What were some of the highs and lows of your journey through care? What were some of the dynamics that popped out to you along that journey for you personally?
The navigation access at the very beginning was quite difficult. They say that cancer patients that have the best mortality rate complete care within 365 days of diagnosis. And it took me 63 days to know if I was going to live or die. So that's 63 days of sitting there trying to be a mom, trying to work and not knowing what's going to happen. And then it took me 83 days to actually start treatment. And when we look at that 365-day window, I missed it by about 3 weeks.
Wow.
And the reason why is because of how it was designed.
You've spoken about healthcare evolving beyond simply patient-centered care towards more of a deeper partnership between caregivers and patients. What does that partnership look like inside hospitals and health systems in your view and practice?
Early in my career, much of the conversation in healthcare centered around the physician experience or designing care around the provider. And over the time, industry has shifted towards patient-centered care, recognizing that patient's voice should guide how care is delivered, like genius idea. Today, the conversation is evolving again towards something deeper, the human experience. And what we're realizing is that patient experience can't coexist without employee experience. That true partnership really begins when healthcare moves from beyond doing care to patients and starting designing care with our patients and with our staff. Because patients bring lived experience. They bring their fears, their values, their goals. Clinicians bring clinical expertise and knowing how the system actually functions. So when those perspectives come together, care improves.
And it suggests that there are some perhaps gaps in the way that care delivery systems are designed now, if it hasn't had the benefit of that patient perspective, essentially. Is that what you're finding as well?
Healthcare, we're really good at getting creative with the resources we have, right? We act in the moment, we fix the problem in the moment, but a lot of times we put Band-Aids on processes and then we do these workarounds that end up taking more time and then it burns us out.
Many healthcare organizations have invested in patient experience initiatives, but their culture doesn't often change. What have you learned about the difference between kind of implementing PX programs and really transforming culture?
Leadership sets the tone for everything in the organization. I remember I sat in a board meeting once and I said, well, the fish rots at the head. It didn't land particularly well in that moment, but the point was true because culture is not changed through programs. It's changed through leadership behavior and operational design. Many organizations, they launch patient experience initiatives that focus on training and service standards. Now, those efforts, they matter very much so, but they rarely address the underlying system pressures that caregivers are facing every day. If clinicians are rushed, if they're overwhelmed, if they're navigating broken processes, compassion becomes harder to deliver consistently. So the organizations that truly transform experience, they redesign the environment that caregivers work in. They reduce the operational friction, they support communication, they create that psychological safety. When the system supports caregiver, compassion becomes more sustainable.